Okay, so we have a great patient from Ohio. Where in Ohio was that?
Canton, Ohio.
Canton. And you are a medical doctor,
Right.
an emergency room specialist, and you had an unusual case. I don't have the video here right now to show, but you had probably the densest case of asteroids that I have ever seen. And
Saying a lot coming from you.
yeah, really. And I've seen a lot of this stuff. Asteroids, it's a judgment call on them, but you wanted to proceed anyway. I wanted to as well, just to see what kind of result we would have. So I did 2 laser sessions, and you noticed an improvement in the quality of vision, right?
Yes.
Okay. I think we can do some more, but you also had an elevation of intraocular pressure, which is probably the only main concern doing laser in the vitreous if you're skilled at it and don't have an erroneous or an aberrant laser pulse to sensitive tissue. It's elevation of pressure. So we gave you some anti-pressure drops. The pressure dropped probably 2/3. And our protocol now will be to give it a little time to go back to normal, which in the vast majority of cases it does. It usually takes 2 to 4 months to actually do that. And we'll do some more laser subsequently.
Yes.
But you're happy, great. But the result, explain the result. I mean, it's the ophthalmologists will look there, they'll say, well, you still have asteroids. What is different?
Well, what is different is the cloud is not as thick, so more light is coming through the asteroids. So I have a better perception on the periphery of the larger clump.
Right.
And so that's allowed me to go down, to 2040, which I was at 2060.
Oh, I didn't even notice that today. So your visual acuity has improved.
It's improved because I don't have to move that clump as often now.
I know, and a lot of ophthalmologists would look in there and say, well, I don't see much different, but it's all the perception of the patient, certainly not a placebo effect on the eye chart. 2 lines on the eye chart, that's amazing. I didn't even notice that yet, but
I bet you the ultrasound, although we did the first one and showed the longitudinal axis below my central axis of vision, was all the way across the eyeball. I bet you it's shorter now.
It possibly is. It possibly is. Anyway, we'll check it when you get back. Have a great trip back to Ohio. You're a great patient. I always love doing medical doctors because they don't ever get a placebo effect. And we'll see you when you get back.
Okay, great.